All right. Starting and finishing chapter 13 today and chapter 14 on Friday. Today, we're talking about physical and cognitive development in early adulthood. That's you, good people. Most of us, anyway, not me. For most early adulthood, this is the ages 18 to 40. It involves leaving home, completing your education, beginning full time work, attaining economic independence, establishing a long term intimate relationship, starting a family, and the timing of these milestones varies greatly. When it comes to aging, biological aging, it begins in early adulthood. It, we see declines in the functioning of our organs and our organ systems. What are the influences to these declines? Our genes, our lifestyle, the environment we live in, and historical period. For example, the average life expectancy has an increased, we've seen an increase of 25 to 30 years just over the past century. Aging in the DNA at the cellular level. We have these programmed effects of specific genes called aging genes. So every time a cell replicates itself, right, it creates a mirror image of itself. At the very end of our chromosomes within the nucleus of our cells, we call these tips telomeres. They shorten for every time they duplicate. We'll talk about what that means. Also, random events. Spontaneously, we see genetic mutations, and there's Uten. And there we go. Let's try it again. There. Cancer can result from this. Free radicals, once thought to be a bad thing, right? Now we're thinking it may actually contribute to longevity, except for at toxic levels, then it's bad. The cross linkage theory states that our tissue as we age becomes less elastic. We see a gradual failure over time of our endocrine systems, right? Or endocrine system, our glandular system. We see declines in our immune system. A combination of theories may best explain our biological aging. So, the ends of our chromosome, right? The telomeres, they safeguard the stability of the cells. They shorten with each cellular replication. Below, once they reach below the critical length, they're no longer able to divide, and as a result, the cells become inactive or senescent. Life circumstances can hasten our lifespan, right? For example, chronic illness or chronic stress, unhealthy behaviors like drugs. Uh, Telomerase, an enzyme, can prevent, even reverse our telomere shortening. Positive lifestyle changes prompt gains in telomerase, the enzyme, and we see these changes well into late adulthood. So it's never too late. Our cardiovascular and respiratory systems, the heart, few resting changes, but reduced performance under stressful exercise. So when we're just relaxing, no changes much, but it's when we're active. We see hypertension, atherosclerosis, that hardening of our blood vessels, right? And that disease declining due to better lifestyle and earlier medical intervention. Lungs, the maximum vital capacity declines after the age of 25. Our connective tissue stiffens with age, making breathing harder and harder. Our motor performance in adulthood changes due to declines in heart and lung functioning combined with gradual muscle loss. Our athletic skills peak between the ages of 20 and 35. Tell those kids to be quiet, Uten. With sustained training, we see a decline in the gradual skills until the 60s, meaning if we have training, it's good. It'll help delay it, right? Our body structures will adapt. It'll minimize these declines. It slows down muscle loss, it retains vital capacities, and we also see an increase in speed to repair and recover. Our immune system in early adulthood, this also declines after the age of 20. A shrinking thymus, reduced maturity and differentiation of T cells. Stress will also weaken our immune response, And these can come in the form of psychological and physical stressors. Sexy time. There's that cat. Look at that cat. That cat doesn't give any. Cat's got nothing to give.
I'm here, by the way.
Hi,
I
Summer.
have a sick child.
Yeah. Oh, we got one of those, huh?
A sick child?
Yeah.
Yeah, he keeps saying that he pukes, and by that he means he spits in the garbage. So he got sent home.
That dirty dog. Our reproductive capacity. It's ideal during our 20s, and of course, this will also decline with age. The fertility risks for women. Problems jump sharply at 35 to 44 years. They're the quality and the number of ova down. Fertility risks for men. Problems are more gradual, and it starts at about 35. We see a decrease in sperm volume and motility. We also see an increased percentage of abnormal sperm. So when we look at the number of women giving birth at different age ranges and compare them from 1970 to 2014. So number of births per 1,000 women, we see somewhere around 75 births in 1970 out of per, each 1,000 women between the ages of 20 to 24. But in 2014, you see only 40. That's almost half as many. But then there's a shift. So in 1970, between the ages of 25 and 29, it drops significantly below half of the number that women between the 20 and 24 age range. But those in 2014, ages 25 to 29, there really is no change. They keep status quo. It changes even more dramatically for the 1970 population, 30 to 34. It drops to like 4.5, 5 per 1,000 women. But in 2014, women are still holding strong, right? They go from 40 to 40 to 30 in the matter of 14 years, 15 if you count 20. In 35 to 39, still the same pattern. 40 to 44, both drop significantly, but still more in 2014. So we're seeing essentially the advent of birth control and equality in the workplace and equality in our education systems. It's allowing women, it's affording women the choice of when they want to make a family, when they want to have a baby. It's as simple as that. Nope. Okay. Any questions so far? All right. The variations we see in our health. Compared with other industrialized nations, the US has the greatest death rates for all causes in early adulthood. The greater the socioeconomic disparities in health and mortality, especially. Some influential factors: how much we make, how educated we are, what's our occupational status, do we have health related habits, did we have poor health in childhood? As a child, did we grow up poor? What about just the rates overall of our industrialized nation? Lack of universal health insurance, greater inequalities in health related environmental factors like the housing we reside in, the pollution around us, the access to education, quality education, and various community services. When we take into account the leading causes of death between 25 and 44 years of age in the United States, unintentional injury for men is higher than women, significantly greater than once you get down to the cancer, and then it's more women than men, then heart disease, more men than women. But you see it's dropping, dropping, dropping overall. Suicide greater in men, homicide greater in men. Weight, overweight, and obesity in adulthood. 72% of Americans are affected. What are the causes? Our genes. Also, declines in physical activity. We have more sedentary lifestyles, transportation, jobs, what we do for fun. We're increasing our calorie, sugar, and fat intake. And the basal metabolic rate, we know our ability to burn things, calories and things, it declines with age. The consequences of overweight and obesity: heart disease, diabetes, various forms of cancer, earlier death, social discrimination. It's more difficult to find mates. It's more difficult to find housing. It's more difficult to uh, get educational aid, to get a job. Even juries don't, um, what's the word I'm looking for? When they when they come to a ruling, juries are more harsh on people who are overweight. Also, some other consequences: anxiety, depression, lower self esteem that perpetuate poor eating habits. We treat obesity: lifestyle changes, changes in our diet, changes in how much we exercise, keeping track of what food we take in and how much, keeping track of our weight, having social support, having counseling resources, developing problem solving skills instead of getting all stressed out and anxious about something. And as a result, eating, maybe you go for a jog, maybe you call your mom. We need to provide extended intervention. We need to be provided time to develop new, healthier habits. Our diets, the fat in our diets, saturated fat from meat and dairy should account for only 10% or less of our daily calories. This plays a role in heart disease, breast, and colon cancer. Excessive fat converts to cholesterol. So we need to replace the saturated fat with unsaturated fats. We find this in most vegetable oils, nuts, seeds. When it comes to complex carbohydrates, we get that in our whole grains, our fruits, our vegetables. And of course, regular exercise will help eliminate cholesterol. What we see here is three different nations: the United States, Caribbean, and West Africa. You see, the United States has the highest proportion of dietary fat, also the highest proportion of high blood pressure. And you see the pattern: more dietary fat, more high blood pressure. There's that. Also, you see within West Africa, more exercise, lower blood pressure. So, exercise. What's recommended? 150 minutes per week of at least moderate intensity and 2 sessions of resistance exercise per week. Nearly half of Americans are inactive. This is more the case with women than men. It's greater among the low socioeconomic status adults, and overweight and obesity are strong predictors of inactivity. The benefits of exercise: it's not just weight. It does reduce fat, it does build muscle, it does also boost the immune system. It provides resistance to illnesses and diseases. It promotes cardiovascular functioning. It also benefits our mental health. It reduces anxiety, depression, stress. It improves our mood. It enhances cognitive functioning. Remember, blood's job is to deliver stuff that we need to live, but also remove stuff we don't. So if we're moving the blood around more, faster, cleaner, then we're cleaning up areas in our brain as well. Exercise also leads to longevity. Substance use in early adulthood. This peaks at 19 to 25 years of age and then declines. Risky experimentation is greatest in early adulthood. Up to 16% are substance abusers. We're talking about, alcohol mostly, but tobacco, marijuana, other behaviors that increase: binge drinking, driving under the influence, and the use of prescription and party drugs. When it comes to smoking, tobacco and marijuana, cigarette smoking is slowly declining, only 17% of US adults. Most of the decline we see among college graduates. There's a rise among adults that do not finish high school, especially women. and most smokers start before the age of 21. Young adult use of tobacco of other forms of tobacco has also increased, like vaping. Deadly health risks for regular smokers: 1 out of 3 die from smoking related diseases. The majority will suffer at least one serious illness. Now, we are obviously not talking about Jake the Snake's Gam Gam. Quitting smoking, and that's on the record. It's hard to stop. Most in treatment programs restart within 6 months, so counseling is needed to teach skills to avoid relapse. Preventive efforts and education must reach adolescents and young adults when it's about to start. We have to convey the negative effects, the negative health effects of other smoking forms as well. Like marijuana, despite legalization, results in dependency and problematic withdrawal symptoms like depression and anxiety. Alcohol abuse in early adulthood: 9% of men, 5% of women are heavy drinkers. One third of heavy drinkers are alcoholics or, you know, alcohol abusers. This usually begins during early adulthood. College students drink more heavily than non college students. What are the motivations to drink? Women, to read, it's often in response to stress. Men, to enhance social situations. We're having a kegger, we're having a bonfire, we're having a party. Alcohol abuse in early adulthood continued. Risk factors include heredity, our metabolism rates, and our temperament. Cultural influences: you grew up in Ireland versus Italy, completely different, right? Ireland, they do not condone childhood consumption of alcohol, but they do condone public drunkenness. The reverse is true for Italy, and you see alcoholism rates significantly lower in Italy than you do in Ireland. Also, some other risk factors include poverty, hopelessness, and a history of abuse. Results in many physical and mental health problems. The cost to society, for example, of fatal motor vehicle accident. Treatment is difficult. Half of those treated often relapse within a few months. Heterosexual attitudes and behavior. Most heterosexuals have intercourse by age of 25. Now we're saying heterosexual, not homosexual, because there are more options for heterosexuals. Not only, hi honey, not only are there more options, but there's less risk. As in, homosexuals don't want to come out. They're fearful. There's not that many out there, less to choose from. Okay. Their fear of discrimination, the whole thing, you all know it, but that's why we're talking about heterosexuals. Typically, in the context of emotional commitment, is when they're doing it. People tend to seek out similar partners. They'll meet through friends, but increasingly online. There's a trend towards more sexual partners in a lifetime. Partners in committed, remember this, partners in committed relationships have sex more often, hoorah, and are more satisfied, hurrah. College years are marked by a rise in uncommitted sexual encounters, such as hookups and friends with the bennies. Now, here's another interesting one. When they asked people in 1977, 1990, 1996, 2000, 2004, 2008, 2012, how much is how much is premarital sex wrong and how much is it not wrong at all? So in 1977, somewhere between, let's say 36% said premarital sex, it's okay. But in 2012, it was almost 60. They're like, yeah, it's good. Go for it. But you can see this weird thing. 1977, they were less approving of extramarital sex than they were in 2012. I'm sorry, they're more approving, less approving of premarital, but more approving of extramarital. It's kind of reverse. You would think that it would be permissive, more permissive across, but it isn't. Why do you think that is? Okay. Well, I mean, it's culture. It's culture. Sexual minority attitudes and behavior. Okay, so sexual minority attitudes. Public acceptance is growing. An estimated 3.8% of the US population identify as lesbian, gay, bisexual, or transgender. It's actually higher than that. That's kind of low. It's like 5 point something, around 5%. Oh, you know what it is? Hold on. It's like 4 to 6% of men, and so we'll say five, and like 4% of women. So that's lower than both of them. Sexual behavior that they exhibit or experience is similar to that of heterosexuals. These people tend to live in larger cities or college towns where there's more liberal mind thinking. Those who openly identify also tend to be more educated. The percentage of US adults who support same sex marriage. They asked baby boomers, Generation Xers, and millennials. And what you can see over time, not only did baby boomers, Generation X, and millennials also become more supportive of same sex marriage, but you also see that millennials were always greater than baby boomers from the very beginning. Culture, culture, my people, culture. Let's get some. Sexually transmitted infections. Let's not get those. And sexual coercion. In the United States, 1 in 4 contract an STI during a lifetime. AIDS. Among industrialized nations, U.S. has the highest incidence of HIV positive adults. Uh, multiple as a result of multiple sexual partners, intravenous drug use, but that is not the only reason. Those are not the only reasons. It could be one sex partner. It could be you're getting a blood transfusion. There are many ways to contract AIDS. Sexual coercion. Almost 1 in 5 women are victims of rape. 1 in 5. Personal characteristics of the perpetrator and cultural forces are predictive. Although mostly male, women are also perpetrators of sexual coercion. But let's not fool ourselves. So, what are the perpetrator characteristics? They are manipulative, they are remorseless, they approve of violence against women, they accept myth rapes, they misinterpret social cues, they may have experienced childhood sexual abuse, they may have been more sexually promiscuous in adolescence, and they may be alcoholics. Cultural forces. Men are taught to be dominant and competitive. Women are taught to be submissive. Uh, there's this acceptance of violence, and then we have this dulled sensitivity due to media, pornography, and pornography. The consequences of sexual coercion. The immediate consequences: shock, confusion, and symptoms similar to post traumatic stress disorder. Long term consequences: fatigue, depression, substance abuse, social anxiety, difficulties with intimacy, suicidal thoughts. Also, there's physical injury that could take place, uh, and possibly contracting an STI or getting pregnant. So, how do we prevent? It's not just as simple as making the punishments harsher. We have to get to it before it happens. We need to provide community services like safe houses, crisis hotlines, support groups, legal aid. So that's how we're treating it, right? We have underfunded. It's underfunded, right? So we cannot serve everyone, especially we have very few options for victimized men. For rape, both individual and group therapy is vital. We need to provide routine screenings. We need to validate that this did happen, not ignore it and go, come on, it was 15 minutes, or come on, you whatever, right? It happened. You said it happened, it happened. And we have to develop safety planning. Psychological stress. Okay, now we're off of that. We're off of the sexual coercion and rape. Now, also in early adulthood, we experience psychological stress. And this is related to adverse social conditions, traumatic experiences, or traumatic life events. People die, people move, that kind of thing. And just regular daily hassles. Stress exposure is greatly increased by low socioeconomic status. Psychological stress is also associated with being overweight and obese, associated with diabetes, cardiovascular, gastrointestinal problems, and decreased immunity. So as we age, you can see the cognitive affective complexity, meaning the complexity of our thoughts and feelings just from the age of 10, just climb, 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 climb until you hit about 20 to 29. And you still climb, 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 but not as steep until you hit about 59. And then you finally go, you know what, frig it. Expertise and creativity, right? Expertise, this is the acquisition of extensive knowledge in a field. This takes many years. It also enhances our information processing. What's essential for creativity? We move from problem solving to problem finding. There's something about the 10-year rule. You do the same job for 10 years. You're not just solving problems, now you're catching them before they happen. We see a rise in creative productivity in early adulthood, and this depends on multiple personal and situational factors. Here you are, good people, the college experience, the formative developmental testing ground, right? You're being exposed to new ideas, new beliefs, and demands that foster diverse cognitive capacities. You're starting to reason about problems that don't have clear solutions. You develop broader attitudes and broader values, but you also strengthen your sense of identity. Some of this depends on participation in your campus life, though. Are you involved? Are you are you talking to your classmates? That kind of thing. Are you going to different functions? It's very difficult right now, but
COVID has wiped that out.
COVID's yeah. But I still see Trish texting Uten, "Hey, you coming? Cones on you, right?" It's still happening, just in different forms. Yep. I see how tight your little nursing cult is. All right. Dropping
Cult?
on, huh? Yeah.
Cult?
Yeah, it's a cult. Don't tell your professor said that though. All right. Well, it's too late. It's recorded. Okay. The U.S. rate for dropping out of college, 42%. 42% don't graduate from a 4-year institution 6 years after enrolling. There are some personal factors that come into play. They're underprepared. They have no motivation. They lack study skills. They're emotionally dependent on their parents. There's also financial problems, right? Especially this is difficult with low socioeconomic status students. We need to provide institutional support services, and we have to provide early preparation for college. How important is academic engagement in college for successful transition to the labor market? We see that successful graduates are aware of the link between collegiate learning and their career, right? This is your nursing people again. These are all you guys, right? The acquired valued skills like critical thinking, complex reasoning, written communication skills. Most graduates enter the labor market unprepared, right? Why? Maybe because academic demands have receded. Maybe because of grading inflation has increased. So the colleges need to, I know you don't want to hear it, upgrade course rigor and promote career relevant extracurricular experiences. Now, from early and middle childhood all the way up to adulthood, our ideas of what our jobs, our vocations will be change. First one, yeah. The first one is the fantasy period during early and middle childhood. It's glamorous, right? You choose it based on glamour. I want to be an astronaut. I want to be superwoman, right? Then there's the tentative period, 11 to 16 years of age. At first, it's in terms of what you're interested in. I want to be a YouTuber. Then you start to realize, I can't YouTube, right? So you're like, I won't do that. I'm going to be instead, I don't know, a teacher. Then you go into your realistic self, your realistic period, right? Late teens, early 20s. Here's the exploration, right? You start to look at different possibilities that blend with your personality traits. And lastly, crystallization, where you focus on general vocation categories. I want to be a teacher, just not really sure which one.
This happened to me when I was little. We made these things in kindergarten to remember I guess kindergarten. It was a time capsule and I got it back my senior year and I said I wanted to be a teacher. And then in middle school I was like, I want to be a chef. And then for a while I was like, I don't know what I want to do. And then I chose nursing.
That's funny because I can't imagine you as anything else but nurse. That's weird. But I can see as a teacher. I can see as all those things, but yeah. I don't know. I get nursing from you. All right. Factors influencing vocational choice. Your personality. That's what I get out of you, Jake the Snake. Your family influences, right? Your the parent-child vocation similarity. Parents teach, and obviously, a lot of times the children become teachers too. Parents are construction. A lot of times the children become construction workers. Parents are engineers. Parents are doctors. Parents are lawyers. Parents are food service. Children follow suit. Our teachers influence our vocational choice. Gender stereotypes influence our vocational choice. Women's, we have seen women's progress in male dominated fields like engineering, but it's slow. Educational and job opportunities. And lastly, current life circumstances. Oh my God, Samantha. So, personality types and typical vocational choice. If you have the investigative personality type, maybe a scientist or an engineer. Social, a counselor or a teacher. Artistic, or realistic, a construction worker, a plumber. Artistic, a writer, a musician. Conventional, accountant, a banker. Enterprising, maybe a supervisor or a politician. More cultural influences, masculinity at work. Men will sometimes choose non traditional careers. The characteristics of men in female dominated careers, they seem to be more liberal in social attitudes. They are less gender typed. They focus less on the social status of their work, and they are more interested in working with people. They'll choose careers with higher incomes, promotion, leadership. But the challenges are there's typically a lack of male mentors. There's also implicit gender discrimination. Other challenges, sometimes there's a stigma, mostly from other men. So a common, like a hairdresser, right? Vocational preparation of non-college bound young adults. U.S. high school graduates are poorly prepared for skilled occupations. They lack vocational placement and counseling services, but work study apprenticeships can help. There's this European model program, and it's rare in the United States that we offer these work study apprenticeships. All right.
It's like CV Tech, right?
Yep, exactly. BOCES.